name is Dr. Kyle Murray. I am with Atlas Brain Spine in Upland, California, and we are a NUCA chiropractic office, which is a specialty of Upper Cervical chiropractic, and I'm one of the doctors there. So what I do myself to help maintain my own body, one is exercise. I love to work out and to throw weight around and make sure that I'm progressing the way that I want to personally. So currently I've been doing CrossFit for about a year now, and I've been loving it. I love the community, love the exercises, and just the progression of rehabbing my own body, doing things that I never thought I would be able to do. It's a lot of like high intensity workouts that cycle. So you're doing multiple different styles of exercise and a lot of Olympic lifting, which has been really neat because I've never done that in the past. So just learning how to clean, learning how to do a jerk, learning how to do properly deadlifts and to bench and do these exercises in a class setting with a coach that is knowledgeable and is able to communicate properly if I'm doing something wrong. So I love having somebody watching over to make sure that I'm actually lifting properly, that I'm not going to injure myself as I'm doing these lifts and trying out these new things. I love that exercise involves strength. I love that it involves cardio and that involves a lot of the core. And you're just mixing it up and making sure that your body is overall as healthy as possible. To build strength within the body, I think is critical. And you have the mitochondria within the muscle, and those are the powerhouse of the cell. You're producing energy. So to be able to continue to produce energy by growing more muscle, your body's able to process and metabolize faster. So just having all those things are really important. Of course, cardiovascular health is crucial. I like to also run and do endurance things like rowing. So I think that's important to mix into, but I really love the focus on strength. I love to test on myself before I recommend it to patients. I was kind of taught within the upper cervical world to kind of dial back the exercise for the patient as they start care. And what I'm starting to realize is that there's not really any evidence to show that. And from my own experience, I definitely had a little bit of a dip in terms of how well I held right away. But as I got stronger, I've been holding better and better and longer and longer. I think there's a huge component to building up the strength so that you're building up that foundation to help to stabilize the structure you're trying to stabilize, right? You need to have those muscles involved properly. You need to have the soft tissue involved properly to maintain and stabilize that proper position. And so building that strength, I think, is really important to do too.